I decided to do the program in 2012 after talking to my primary care physician about options to get rid of my pain. In 2008, I fell off of a mechanical bull. I felt bruised right afterwards, but had never injured myself before, so there was no need for me to go to the doctor in my mind. And then I spent 4 years in constant pain, trying everything from acupuncture to pain medicine to physical therapy, and nothing was helping. And so then I spoke to my primary care doctor in 2012 about other options around town, and he suggested the pain rehab program at Mayo. Before the program, my functioning level was incredibly low. I went from someone who was very active, from playing tennis, to doing kickboxing, to running half marathons, to all of a sudden not wanting to get out of bed in the morning, not wanting to go to work. I couldn't look down at my toes without having severe pain in my neck, and just became very sedentary. As far as physical activity, even to being social with friends and family. So after the program, I noticed within a week that I was able to move my neck more. I was able to get out of bed a lot easier. I actually wanted to get out of bed and do things. And then after I graduated the program, it really opened the doors for me to go back to my active lifestyle. From running half marathons, I recently did the Donna Hicken half marathon. I've done the river run twice since graduating from the program. And I'm much more back to my normal self of socializing, not canceling plans with friends and family, and really getting my entire lifestyle back. Challenges during the program was really always trying to have an open mind, even though a lot of the concepts they teach you are quite common sense. I think just really remembering that everyone is there to help you, even though it is kind of a tough love environment. One of the other challenges for me was being on a pain medicine that the doctors had told me did not have side effects or withdrawal effects. And then once I was going through the program, I had side effects from the not taking the pain meds anymore. And that was pretty tough for me to realize that someone had told me this great thing is going to make you feel better, and it really made me feel incredibly bad. I think after going through the withdrawal period and still being here in such a controlled and structured environment and having the nurses and doctors right beside you, within, I would say, 2 or 3 days, I felt amazingly better. And it was such a vast difference to even how I felt prior to the program and consistently taking the pain medicine. Challenges since I've graduated the program have varied from knowing when to push yourself as far as being physically active, also to really sticking with the core concepts of the program. I was able to fit the PRC lifestyle into my regular lifestyle once I got home, very slowly. I think another challenge of mine was when I left the program, not being able to go back to work full-time immediately was a shock to me. So I had to gradually build back up to working 8 hours a day. But then once I hit that, it was kind of already embedded with me, the PRC values and all of their ideas. So it wasn't too difficult to kind of get that back into my lifestyle. The PRC tools that I found the most helpful have been getting on a regular sleep schedule, the physical activity and exercise, and that's anywhere from stretching to getting up out of the bed and making yourself go to the gym or go for a run. and also how to not be so stressed, to kind of take every day as it comes, and really remember to think about yourself, not pleasing everyone else. One of the tools I learned in PRC was moderating, and I use that a lot at work as well as at home and in my social life. I think one of the major important things was learning that at work it's okay to tell your supervisor or your coworkers that you only have this much, before your breaking point. And I think being open and honest about that really helped me in my job. As well, that transferred at home as well, to let your family and friends know that, you can go to this cookout and then go to the mall or do something active, but then you need breaks in between, and for them to be able to respect that. My overall happiness and quality of life is incredibly high. I spent 4 years not being very happy. I kind of put on the front of I'm okay and everything feels great. And then after PRC, I felt much more honest in telling people that I am really okay, and I am very happy. I have a wonderful job that still allows me to do what I love, and I have a great home life and a great social life with people who have supported me from, the time of the accident all the way through the program and to now. My friends and family before the program were supportive of me getting any sort of therapy, procedures, really medicines that I needed to make me feel better. And then when I started the program, I think this really opened their eyes to that as much as they were supportive before, sometimes it may have been the wrong kind of support. So with the help of the doctors and nurses, my husband and my parents were able to kind of learn what to say to me and what not to say. My mom even sent out an email after the first family day to our friends and even extended family to say, don't ask her about her pain, don't ask about the program, she's doing great, which even to this day, they still stick by that. I will say that after the program, they are still the most supportive people in my life, and I could not have made it anywhere through this program or since the time of accident without any of them. My social circles have, I wouldn't say changed, maybe adjusted a little bit, as far as who knows what I have been through to the people who maybe haven't and they've only known me since after the program. I, like I said before, have a wonderful circle of friends and family, coworkers, who understand what I've been through. So it's been easy for them to kind of adjust to the new me where I'm not laying in bed or canceling plans. They've kind of just stuck with me through the whole program. The opportunities that I have now, having been through the PRC program, would be being able to be much more physically active than I was even prior to getting hurt. I think it means a lot more to me now to run a marathon, to hit certain goals, as well as even in my personal and professional life. I've changed jobs to something less stressful. I also think much more about myself before thinking about other people, and always keep my health and my moods and how happy I am in mind before going the extra mile to work so hard to please everyone else. Um, One main piece of advice I would give future candidates for the program would be to come into the program with an open mind and invest as much into the program as the doctors and nurses and staff invest in you. I think if you come into it with an open mind, even though some things may seem common sense or cliche, I think if you go by that the next 3 weeks, you will come out feeling amazing. My piece of advice for current patients going through the program would be to stick through it, and to keep going, to know that after you graduate, it's not over. I think one of my challenges too was thinking that next day I would be able to return to work and I would miraculously feel 100% better and like I could do everything I did before. I think there's so much more that PRC has to offer than just those 3 weeks, and it continues into your 6-month period, a year after, to your whole lifetime after.